Hello, my name is Pedro Rodriguez and I am a board-certified plastic surgeon. In this channel, we discuss luxury self-care practices of all forms. Today, we're going to be talking about abdominoplasty, the procedure, the recovery, and what to expect. Leave a comment with any questions or concerns. Don't forget to subscribe below. Welcome to our conversation. A good candidate for a tummy tuck are patients that have lost abdominal domain. They have excess skin, excess subcutaneous tissues, and through the tummy tuck procedure, we not only tighten the abdominal wall, reshape the abdomen by tightening up the muscles, we also remove the excess skin and tissue to give a better overall appearance. On the video that we're going to watch, we had a great patient of ours that allowed us to go ahead and videotape her experience, and all the things that we planned were based on the patient's wants and the patient needs. Through the process of abdominoplasty, I think that it's extremely important that we not only address the abdominal wall, but we definitely address the vaginal labial area. We made certain that we did an aggressive liposuction so that the patient could have a significant better result. Liposuction, while not a weight reduction procedure itself, it definitely molds the patient's core and allows us to shape better the overall abdominal trunk area. Along with the liposuction, we went ahead and performed a tummy tuck, into which we removed the excess skin and excess tissue of the abdominal area while definitely lifting her girl parts. And this is what I'm narrating. Look, I'm lifting, and then after, I have them hold, okay? And then I flatten it so that we know exactly where that incision is gonna go. The skin and the soft tissue just above the superior confluence of the labia majora is called the mons, and that area is critical for a great result. In our abdominoplasty procedures, we routinely make certain that we liposuction that area, that we mold that area, and more importantly, that we lift that area. We try to always make the incision as low as possible so we can have not only a hidden incision line, but also a significant lift of the mons, giving that whole entire area a very youthful appearance. Every single patient is a new canvas. Every single patient has an experience for us as surgeons as well as patients themselves. What we do different in our clinic than other surgeons do is that we are extremely good incorporating the art of plastic surgery with top-notch technique as well as expertise. One of the aspects that we're extremely critical about is the position of the belly button after we perform the abdominal wall plication. I routinely like to elevate the belly button at least a centimeter, and I firmly believe that it balances out the result of the overall condition. Now, yes, we don't want to create a belly button that's way too high, but we want to have the belly button almost right at the peak of that hourglass position. At that moment where the belly just kind of dips in. And by doing that, it centers our visual cue to see that the abdominal wall and the overall look of the abdomen is more youthful, thinner, and with a better overall shape. There are different techniques to define the overall shape of the belly button. If you do a search on the internet, there are stars, there are triangles, there are frowny faces, happy faces. I'm a firm believer that a natural belly button is more of an oval shape. So before we start cutting, before we do anything, we measure the true natural belly button before the procedure. We measure the inside, the outside base, and the overall length of the belly button. We take all those measurements and translate that then into the art of doing a good belly button for our patients. By considering the original shape, the original length, then we match that with the thickness of the abdominal wall after liposuction and after the tummy tuck is completed. By doing that, we want to reduce that distance about half, and that is something that has evolved for me throughout my career. My professors definitely didn't teach me that. It was actually a great plastic surgeon that I met in Puerto Rico. His name is Claudio Corral. And he taught me exactly how to shape the belly button to give the best result. And what we do now is we create that belly button stock about half the overall height and the overall thickness of the abdominal wall itself. And by doing so, we assure that all our belly button's scar is inside the belly button versus the outside. And if you look at our pictures, you will see that while the belly button is well defined, it has a youthful oval appearance, and all the suture lines are inside the abdominal wall. Tummy tuck incision is typically an incision from one side of the hip to the other, as low as possible to make sure that we can hide those scars. However, every time that we make an incision, there will be a scar. Scar management, therefore, is key. Through the first 6 weeks after surgery, we try to keep those incision sites taped. And what taping does is something very important. It prevents movement and it prevents shearing of that incision site. Also, by applying a thick area of tape all around those incisions, we're balancing the tension, we're balancing the pressure on those incision sites so that the incision is as undisturbed as possible. After the 6-week mark, then we start scar management, scar gel, more massage to the site, and eventually, depending on how patients heal, we have all sorts of different techniques to treat scars. We have IPL lasers, we have skin needling, we have bleaching creams for patients like me, for a little bit more dark skin. That is extremely important because we heal darker first before clearing out and having those incisions return to normal skin color. So through the process of healing, scar management, incision management is key. Pain medication and pain medication regimen, while it's unique for most patients, we try to minimize narcotics to optimize the patient's well-being and to minimize any concerns of dependency. We make certain we use anti-inflammatories and utilize other modalities for pain control. It is amazing what a little ice can do. After surgery, we optimize recovery, but not only hydration, also by having our own special cocktail of post-recovery infusion that we can do through our IV therapy clinic. Our IV therapy clinic is included within the aesthetic space into which we have a designated person and a designated nurse that not only administers the fluid, accesses the IVs, and monitors the recovery to make sure that the patients have the best result. Through the process of our pre-op evaluation, we identify possible needs and we identify possible opportunities for the patients to improve in their support system prior to surgery. Having the appropriate support will definitely allow the patient to have a better recovery and a better patient experience after surgery. Throughout the post-operative period, especially for the first 6 weeks, compression garments are definitely needed, not only to keep the shape and to mold the body according to our specifications, but also to prevent swelling and improve all that fluid to mobilize and get absorbed by your body accordingly. After our tummy tucks, we definitely use drains. There are different parts and different conversations of drain versus no drains. I strongly believe that the fluid that accumulates after surgery does have inflammatory components within it. So by evacuating that fluid, we minimize pain, we minimize swelling, and we optimize the patient experience. So I do tummy tucks with drain for that purpose. Support is going to be very important in terms of mobility and in terms of overall balance for those first few days. Something as simple as walking, something as simple as going to the bathroom, and definitely something as simple as getting out of bed is definitely a task that is going to be a challenge for some patients. I would say that after day 10, most patients move fairly well, but those first 10 days, support is definitely needed. Every time we do surgery, we have a designated recovery team. We have first day visit, a third day visit, and we continue to see the patients throughout the patient's journey to make sure that if there is any pain, any concern, any issues that we need to address, we address them in a very rapid way. Returning to activity is a very common question after a tummy tuck. While that is very specific for every patient, the journey usually is time-wise very similar for a lot of them. In terms of normal movement, you're experiencing normal movement about 4 weeks, but definitely that takes about 6 weeks. Returning to exercise depends on every patient, but it's very important to understand why we give timelines for recovery and for movement. Cross-linking of collagen, what makes that incision, what makes all those repairs stabilize and be stable for movement and activity, peaks at the 6 to 8 week mark. So when we tell patients, yes, you can return to normal activity and you can return to working out after the 6 to 8 weeks, it's not because the time is a preset time. It really comes from science. It really comes from that cross-linking of collagen and making those repairs and making those suture lines as well as those incisions as stable as possible. Regular activity depends on what regular activity means for the patient. We have patients that do all sorts of different things, from police officers to accountants to a pharmacist like my mom or a doctor like myself. We have all patients from different stages in life, and regular activity for them is different. So instead of saying return to regular activity at a specific date, we work with those patients, but most patients by the 8 week mark should be returning to regular activities. If you enjoyed this video, like us, subscribe, and stay tuned for next week's show. See you next week.